The Zenesys open source platform Harmony was built so that decision makers can interact with 100% of their data via a single unified platform for analysis. And so what that means in practice is that via Harmony, a decision maker could interact with all of their indicators from their DHIS2 system, but they could also query and combine for analysis any indicator from any other system, including those that are not in DHIS2. So that could include their supply chain data, their financial management data, their workforce data, their equipment inventory data, as well as survey data, Excel data, proprietary system data. Really, any structured information source can be combined for analysis here. And one thing that sets Harmony apart from other visualization tools is that visualization tools that are top of the line are really great for visualizing data, but often restrict you to being able to look at one source of data at a time. With Harmony, we can look at all sources of data all at the same time and combine those data for analysis. And this can be really important when we're designing interventions. So for example, if I wanted to design an intervention to improve pneumonia program performance, I could type in PNEU and see all of the indicators from integrated systems related to pneumonia and see the total hospital admissions as a result of pneumonia from one source of data, for example, which is actually pulling data from thousands of health facilities in the country. I could also look at a second source of data to see where have vaccines been administered for pneumonia. Where are there deaths as a result of pneumonia? Where are hospitals and how much are hospitals spending to treat pneumonia? We've just pulled data from 4 different data sources that are sitting in 4 different locations. And now we can go and disaggregate this data according to the municipality level and filter it to say, I want to know what's going on in Sao Paulo State, for example. And I want to look at data as it was reported, not just yesterday or the day before, but I actually want to look at all of this information as it came in over the last year, for example. We can enable you to combine and then query and filter this data on the fly, and combine these routine sources as well with other types of data like survey data. So if I wanted to look at this information side by side with population data, I can do so. And then I can go and create new indicators that I can use to improve program performance or design interventions. So if I wanted to create a mortality rate indicator, for example, I could do that by taking the total number of deaths divided by the population times 1,000, for example. I could look at the total number of vaccines administered per 1,000 by doing something very similar, by taking vaccines administered divided by population times 1,000. And then I could, while I'm at it, create a financial indicator to look at the cost per service for every hospital in the state and every hospital in the municipality of Sao Paulo to treat pneumonia. And in each case, what we've done is we've created new indicators that are actually composites of information from different subsystems and combine them for analysis. We can also then go and look at this in different ways. So in this visualization, we're now going to look at this as a bar chart. If we wanted to figure out where could we target a vaccine distribution campaign to maximize impact by looking at the places that had high rates of vaccine administration or vaccine coverage side by side with mortality as a result of pneumonia, we could very quickly do that by servicing this information side by side so that we could determine which municipalities would have the greatest potential to bring down mortality rates as a result of a very targeted vaccine coverage campaign as opposed to other municipalities. This kind of insight would be difficult to do if we were just looking at a single siloed data source, but it's easier to do via Harmony because we can combine these data for analysis to target interventions. We can also look at information geospatially. So in this case, if I wanted to look at whether we had clusters of pneumonia cases, we could very quickly do that. And then we could go a step further and overlay supply chain information, for example, to see where do we have available beds or ventilators, et cetera. And all of these visualizations can be saved to dashboards that update in real time. The big problem that we're solving is integration of data. And so you can look at this data not just via our analytics tool, but via other analytics tools as well, like Tableau, Power BI, or even DHIS2.